So I am doing my hours at the Weedsport Animal Hospital. I'm doing both preceptorship 1 and 2 there. So this is my PowerPoint presentation for my first set of hours. So on the left, this is one of the vet assistants trying to get into vet school. Her name's Lauren. She's actually friends with a girl who goes to SUNY Delhi, and she's very nice. She's helpful. Um, she works at a zoo part-time also, and she's very excited to be there as well as me. And then we have Christy in the middle. She's so nice. She's great. She really is. She is my go-to when Elaine, the main technician, isn't there to help me. She works the front. She teaches me, the computer system and doing the medications. I love standing up front with her whenever it's not super crazy. And whenever the labels print out, I always count up the medication for her just to make her life a little easy because it does get hectic up in the front. And then Dr. Hop on the right, she was looking through the microscope. I think she was looking at an ear swab in that picture. And I was, running around taking pictures of everybody who was okay with me taking a picture of. And I was like, Dr. Hop, smile. And I don't know if you could tell, but she's smiling in the picture. She's a really great doctor to work with, too. It's right now a 2-doctor clinic, but the main doctor, Dr. Schnabel, he recently sold his clinic to her. So he's trying to retire, but you never really retire in this kind of field. He's there every day, even though he's supposed to be semi-retired. So the rest of the clinic, on the left is our clinic cats. Our clinic hosts mainly small animal, cats and dogs. Occasionally we'll get a rabbit, maybe a guinea pig. There was a chicken here once, but for the most part, we work on cats and dogs. In the middle of the picture is our x-ray room. It's got a few towels there because we had just x-rayed a little dog. But I love the x-ray room because I love when we get an animal in for an x-ray because I'm so excited to see what's going to pop up. Just a few days ago, we had a cat come in where you could actually feel the sandy grittiness in the bladder, and we took a picture of it, and that was fun. It was fun to finally see what I was feeling and know where to look on the actual x-ray picture, which was really nice. And then all the way on the right is the exam room. That is the surgical table slash technician exam room. This is where we do the quick nail trims, the rabies shot, just the rabies vaccines, just real quick, in and out technician visits. So I spent a lot of time back there and also up front. But we also have kennels in the back, which are not pictured, but the kennels, we don't have a whole lot of dogs go back there. That's only for if a dog is vomiting a lot, but it gets very hot out there, so most of the time the animals are inside and in the cages. My first case study was about Dano, a yellow lab puppy who was presented with not eating, lethargic, vomiting, and straining to go to the bathroom. Immediately, Dr. Hop expected him to have an obstruction, and he was x-rayed. We could see the blockage in his intestines, but we weren't sure exactly what it was. So for further evaluation, we sent it out to have it observed. When the x-ray came back, it showed a corncob-like obstruction, and he was scheduled for surgery that night. Dano was then given acepromazine to calm him and prepare him for surgery. This was the first surgery that I would be observing throughout my preceptorship, and I was very excited. One, because it was a surgery, and two, because I actually knew this dog. It was my friend's puppy, so I was very intent on taking care of him and making sure everything turned out well. And so I was given the job of watching over him, and the reason I have so many pictures of this is because I was given unlimited permission to take pictures of him, which is really, really helpful for me to look back on and remember. Once Dana was all ready to go and we had finished our office hours, it was time for the surgery. Surgeries don't usually happen on Thursdays and Fridays, but because this was an emergency, we had to get it done. So Dr. Hop opened him up and tried to find the corn cob. When we opened him up, she realized that the corn cob had moved from its original position, which is always a good sign. And so as she was feeling it, as you can see in the first picture, she was feeling through the intestines trying to find the corn cob. And once she found it, she realized it was past the ileocecal junction, which is the junction between the small intestines and the large intestines. So once it got past that, he should have been able to pass it himself. So she did not want to cut into his intestines any more than she had to. He was already very irritated. In the picture you can see his bowel was very upset. It was very angry and red, kind of glaring at you. And so she didn't want to have to make an unnecessary incision on this puppy any more than she had to. So she decided to put him back up. She did stitches on the inside, staples on the outside, and call it a day. So later that night, he slept fine and everything. I went home, and the next morning I come in at around 7:45, and some of the assistants get there at 7:20. So when I got in, he had pooped out the corn cob, thankfully, and there it is on the last picture shown. So Elaine and I theorized, along with Dr. Hop, we theorized that the ace actually calmed his bowel down enough to pass the corn cob through that junction, because he was very, very worked up at our facility and probably at home straining and everything. So that really helped him out, so we didn't have to cut into him any more than we had to. Case study 2 had a 3-year-old neutered canine come in with what seemed to be a bloody nose constantly. The dog constantly had a bleeding nose, and we examined. There was nothing in the nasal cavity when you directly looked into it, so we opted for x-rays. The dog had to be put under so that we could get good x-rays of his head. As you can see in the right-hand picture, there is an obvious blockage in the nose compared to the right side, where you can see all the cavities. The left side, or the dog's right side, our left side, is opaque, which indicates a tumor. The x-rays were sent out, and it did show, in fact, they identified that there was a tumor in the dog's nasal cavity. You can kind of see it in the left-hand picture where the tumor is, but it is better shown in the right-hand picture. The owner sadly opted for euthanasia because the tumor, there was no treatment that we could do at our facility, and the owner could not afford the treatment for this particular tumor because the whole nose would have to be basically deconstructed and reconstructed, and the owner decided it was not a good quality of life for the dog, and so we euthanized him. Case study 3 was my favorite case study, but most upsetting case study. I got to work with this cat mainly because of how fractious it was. The cat did not want anything to do with the vets. She was the sweetest cat at home and everything, but as soon as she got into the veterinary clinic, she had to be gassed down and put under in order to perform anything on it. It took us 10 minutes to get her out of the carrier with gloves and towels and everything, and that was still a very difficult, very, very difficult thing to do. Which that helped me learn how to deal with a cat that was not having anything that you were doing. So once we got the cat gassed down, we examined her. She was presented with not eating, just not acting right, and the owner said she would get wound up and do open mouth breathing. So this was my first ever time drawing blood. Now, you can see the red top tube. I drew that blood before the picture on the left was taken. I drew up the red top tube, and we decided we might need a little more. And so I asked Elaine to take a picture of me drawing up the blood, and of course, in the picture when I was trying to draw the blood, I just couldn't get any blood out, which was upsetting, but I did get some in my first draw, and that was my first ever draw in veterinary practice, which was very exciting. So even though I didn't get it for the picture, I did get it in the beginning. So we ran the blood and nothing abnormal was shown, but when we did the x-ray, which I wish I had taken a picture of, but I didn't think about it, it showed a pneumothorax. So this, because the owner said that the cat had always open mouth breathed when she got excited, we determined that it was most likely a birth defect and that the effects of the pneumothorax were finally acting on the cat, and that the cat wouldn't, and that this was what the cat had been living with her entire life. So the owner, we explained this to the owner that it could be treated, but it's a very difficult process, and with a cat as upset as this one, she gets very riled up, and this was with Ace on board already. There was no way we could treat this cat and not stress the cat out beyond belief. So the owner did, in fact, opt euthanization, which is why, as great of a case this was for me, seeing the pneumothorax, getting to run my own blood, draw my own blood, this was sad because I worked with this cat, even though she was under, I had worked with her for basically the whole day. This was my thing for the day, and euthanization was very hard, but I was able to talk the lady through it, and she decided to leave and not be there, and she wanted me to be there to pet the cat and help her pass nicely. So this was my favorite, even though it was the most sad. It really gave me a good handle on what I was getting myself into. Other interesting cases I had, I just had to put on this slide because I had a lot of cool stuff that I took pictures of. So all the way on the left was a heartworm diagnosis, which in itself is bad, but I can't tell you how, I don't know, excited I was that oh my gosh, heartworm, not excited at all for the dog that the dog has heartworm at all. Like, I don't want to be misconstrued, but it was just something other than a negative, which was just like, oh my gosh. A lot of times we get Lyme cases, but this was an actual heartworm test, which once I told the doctor, she was actually very upset because this dog has been diagnosed before, and we think that the owner just hasn't been doing the preventatives as often as he said he has. But yeah, that was my first heartworm positive on a dog. And then the second picture is, it was taken in between some toes of a dog. He had sores, and I got to dip this and prep it, and I found chain rods, which was super exciting. And then that same day, I found Otodectes in a kitten. I also prepped that one, so that was fun to find. And then the last picture is me with an Aussie who was hit by a car a month ago, was sent to an emergency clinic. They just wrapped it and said they couldn't really do anything for her. She was already about $2,000 in just from the emergency clinic and was not sure at all what to do. Brought it to us. We gave her an estimate, and she was just blown away because of how inexpensive we were. We don't charge crazy for a simple broken leg. So while we x-rayed her and put her under to fix her leg, while waiting to have time to cast her, I got the opportunity to sit on the floor for an hour and a half holding her so she wouldn't jump around and freak out without her mom in the kennels. So that wasn't, wasn't the most exciting day, but I eventually got her all the way to lay down and fall asleep on the floor, so it wasn't too crazy of an issue. So 2 more cases that I have that I don't have a whole lot enough to do a whole case study is the dog on the left came in completely flat out, heavy breathing, struggling to breathe, and we set him up with IV fluids and gave him oxygen, and an hour of just straight oxygen got him standing up and even barking to the point where he was barking, that was a good outcome for him. He also, like Saru, the feline had a pneumothorax, and he was 15. So the owner was going to get back up to us on what he was going to do, but we haven't heard anything yet. And then on the right is a very nasty hot spot. It really doesn't look that bad in the picture now that I'm looking back on it, but it was bad. You can see to the left of the dog's genitals, there is the white, that was all sloughing off. The skin was just coming, like it was just peeling right off. We shaved him down to expose it to the air. He was a Great Pyrenees, just screaming in pain. That's how much it hurt. But we had to get the hair off of him. Like it was bad. He was an outdoor dog, lives outdoors, and the owners didn't really care too much that he was in pain. He was their working dog, and that was another thing I had to experience, that he was just a working dog. But at least they did bring him into the clinic to get him some antibiotics and fix him up. My overall experience at the Weedsport Animal Hospital is excited. I'm excited that I'm doing both my preceptorship 1 and 2 there because I absolutely love it. Learning at this facility is so great for me. I'm putting so much work in here, and they, when I first started there, they were a little skeptical. Yes, I was a client there before, but they were a little skeptical because they have a lot of students come in, and when it comes down to the hard stuff, like cleaning the kennels and taking care of the animals, they don't want to do that. They just want to play with puppies and kittens all day, which is literally the basis of this whole thing, is to show us that that's not what it's about. And I know that's not what it's about. And I really am happy that I was able to put my foot forward and really prove to them that, hey, I'm here to work and I'm here to apply myself. And they really appreciate that. It's really nice to hear from the technician that Dr. Hop always calls for me first. She always, if I'm back helping with someone, she'll always say, Michaela, please come help me hold this dog. And one of the technicians there, she said that's really good to have that trust, to have the doctor trust you that much, to have you holding. And that really makes me feel good. And I'm glad that I can impact clients and help inform them when the doctor's too busy or, it gets crazy. I'm glad that I'm there to help reassure them that it's going to be okay and that, Lyme disease isn't the end of the world. So I'm really happy. I'm really happy that I'm at this facility, and I really am excited for my next hours and my next preceptorship there.